About 1 in 10 of all couples have some difficulty about fertility. This can affect both the male and the female. One of the hardest types of infertility to treat is that in the female where the fallopian tubes are diseased or indeed have been removed. In these cases, there's absolute sterility because this is the place where normal conception occurs. We have been able to do some work about carrying out fertilization of an egg recovered from the woman, fertilized with her husband's spermatozoa, and replaced back into the uterus.
You are about to see a historic birth following in vitro fertilization. This lady is 31 years old, infertile for 9 years, with diseased tubes. Indeed, the remnants of her tubes have been removed. She is pregnant as a result of recovery of an egg, fertilization by her husband's spermatozoa in vitro, and then reimplantation of the resulting embryo at the 8-cell stage 3 days later.
This is the lady Brown, who is now 38 weeks pregnant, and she has persistent toxemia. All our tests have shown that the growth of the baby is satisfactory and that it's mature. And despite the persistent toxemia, we are going to deliver her by cesarean section. My anaesthetist is Dr. Cindy Campbell, Dr. John Webster is assistant. My theatre sister is Sister Astral, and the sister who's going to receive the baby is Sister Marshall, and with us we have the second pediatrician, Dr. Hilton, and Dr. Booth. Table that, please. Now, the usual vertical incision because of what
vertical incision gives a more rapid approach to that part of the uterus through which the baby is to be delivered. So incising through the scar tissue of her previous operation. Now open the muscle sheath. We're now opening the peritoneum so as to approach the lower segment of the womb, which is lying behind the bladder. Now incising the layer of peritoneum between the bladder and the womb, and we displace the bladder downwards. And we are now incising the uterus itself. Just through the muscle there. And now we then open the sac in which the baby is lying, and this rush of fluid is the amniotic fluid. The noise you hear is the suction apparatus, which is sucking up the fluid as it escapes. Of course, it mixes with a little blood from the wound. The hand is now being inserted below the baby's head in order to deliver it through the letterbox incision. The assistant presses on the uterus and expels the baby. Sister Marshall immediately sucks out the mouth and the back of the throat.
The girl is expected.
Continues to clear the mouth, sucking out any of the fluid which may be in the back of the throat. You don't want the first breath to inhale any of this fluid. A good healthy cry. Suction is continuing. In the meantime, we are beginning to stitch up the uterus. Heart sounds and the lung sounds are normal. Pediatrician is now satisfied that the upper respiratory tract is clear. This cry of the baby is excellent, because it means the lungs are being very well expanded. Lovely pink colour, plenty of fat underneath the skin. Good mature baby. The surface of the skin is covered with a greyish-white greasy substance called vernix. This comes from the skin cells which have been active during life inside the womb. This is now clearing some of this vernix off. Baby's not opened her eyes yet. The umbilical cord will be shortened later and a special clamp put on it. The cord is being inspected to see if it has the right number of vessels in it.
Which is 3,600 grams. 5 times 12 ounces, which is 3,600 grams.
I am now handing the baby to Dr. Edwards, whose brains, skill and perseverance has made this work possible. He started this work some 20 years ago and has concentrated a great deal of time and energy into the project. He's been assisted by Jean Kirby, who is in the group. He has been our main assistant. This technique is still in its beginning phases, and there are some problems remaining to be solved. But it is hoped that centres will be set up where people have been properly trained, and this technique will become available to many women all over the world. It is, of course, something which requires to be very carefully controlled and given to people in a very strictly medical, ethical manner.